And you're all set.
All right. Well, welcome everybody to the Emeritus Center. Speaker today is Vicky Rizzo, and Carol is going to introduce her in a minute. But just wanted to say that Ally is finishing up for this term. We will be back in the spring, putting together that program now, so keep your eyes open for that. And we do have money available for Emeriti that are doing good work, and they'd like to get some support. So we're always willing to take those requests. And with that, I'll turn it over to Carol to introduce Vicky.
So Scott Burge, who's our program director, is under the weather today, and he asked me to give you a little update on Ally and also to introduce Vicky. So I see that several members of the Ally committee are here: Jim, Dan, Tim. Cynthia Fox is not here, and Ed Fitzgerald aren't here, but that comprises the Ally committee. So we've been busy, and we're very pleased with the way things have gone. In terms of the history, many of you know that the Emeritus Center indicated a little, I guess about 18 months ago, that it would front this effort called the Albany Lifelong Learning Institute for 2 semesters. And we were going to start in the fall last year, and we weren't able to get everything up and running at that point. But we were very fortunate because our 3 faculty members who were going to do the first 3 courses were available for the spring. So we just moved everything from last fall to the spring, and we are, as Jim said, in our final week of the 6-week program. Our 3 programs were very well attended by very bright and very engaged people. One of them is the controversial Insanity Defense in American History, which is taught by Richard Ham of the History Department. A couple of members of this group are in that course. Our most popular course was Aging Well, Living Well into Your 80s and Beyond, and that's taught by Yuchi Young of the College of Integrated Health Sciences. And the final course is taught by Randall Craig, who is one of the EC fellows. He's one of our Emeritus Center fellows. He is teaching a course in Neo-Victorian literature. So those were the 3 courses. We're going to have a celebration this Friday. Everybody here is invited to that. It's going to be at the Albany Guardian Society, which is at, give me the address, somebody, Corporate Woods Boulevard. Thank you. Thank you. They have been a very great partner. The Albany Guardian Society, along with the AARP and people at the Center for Integrated Health Sciences, have all been very helpful as we expand this program. We now have an assessment underway, and so we'll have some information based upon that assessment and suggestions for new courses so that we can take that into consideration as we go forward. In terms of our preliminary plans for the fall, what we anticipate is 5 or 6 courses, moving to hybrid and or Zoom only, as well as totally in-person courses. And we want to add those social engagement activities. So stay tuned for additional updates. You'll get them, Neil. We'll send out announcements through They'll come to you through the newsletter, through the listserv, through university marketing, for example. They've been very helpful. And any other way that we have of marketing will get the word out to people. What we have found that a lot of it is word of mouth. Somebody who knows somebody who's taking a course, talked about it, and then others. But that's kind of an update on Ally. Now I'd like to turn it over to Vicki.
Can I ask you a question?
Sure.
What's the earliest you anticipate these courses will start?
What's that?
What's the earliest you anticipate these courses will start?
Right now, we have reservation on the same room that we've been using over at E-Tech, starting September 2nd. Some people have said that's a day after Labor Day, and that probably is too early. So it might be September 9th, the following,
My
the
newsletter
week
comes
of
out-
September.
My newsletter comes out on the 1st.
Oh, okay, all right. And Labor Day is on the 1st, so starting as early as the 2nd, might be a little early. It might be the 2nd full week of September.
Thank you.
Vicki or Victoria.
You can call me Vicky. Everybody
Okay.
else.
You always have been, Vicki.
Yes.
Vicki Rizzo is LCSW/R.
Licensed
License-
clinical social worker.
What's the R?
The R is reimbursement.
That's for third party payers.
I never would have guessed that. PhD and professor. She is senior vice dean, we love deans of vice, and director of the School of Social Welfare at the School of Integrated Health Sciences here at the university. She's also the director of the University at Albany Center for Healthy Aging. She's dedicated her career to demonstrating the value of social work in healthcare settings and community-based organizations through her research, teaching, and workforce development activities. Her research examines the impact of social work and interprofessional interventions that include social workers on healthcare utilization, health and behavioral health outcomes of older adults coping with chronic illnesses, elder abuse, and caregiving. She also examines the implications of the findings of her work for healthcare policy and the financing of the provision of of social work services to older adults and their caregivers. Dr. Rizzo has extensive experience as a healthcare social worker. She earned her MSW in 90 and her PhD in 2002 from the University at Albany. She has served as a field instructor and public health internship preceptor for more than 40 students. She has also provided funding and mentoring to doctoral students in social welfare and social work, and has served on more than 35 dissertation committees in multiple disciplines, including social work, economics, nursing, education, and engineering. I turned it over.
So
to
now I
Vicki.
know what I've been doing for the last 35 years. Thank you for that introduction. It's so great to be here to talk about the College of Integrated Health Sciences and then also the Center for Healthy Aging. This is kind of full circle for me. I began my career as a social worker at Sunnyview Hospital in Schenectady, where I worked for 10 years. And I came back to get my PhD while I was still working there. And a lot of my coursework I took in the School of Public Health. My doctoral chair had a joint appointment in social work and public health. So this, for me, is like full circle. I've always seen the connection between public health, social work, and nursing. And so that's what we'll talk a little bit about today. So the College of Integrated Health Sciences, in September, the president and the provost announced the creation of the College of Integrated Health Sciences. Before I go into the actual college, just to give you a little bit of background, this has been, this is the third year, so 2 years in the making. When I became the interim dean of the School of Social Welfare in 2002, the provost asked me and the then interim dean of public health, Mary Gallant, to explore the possibility of integrating our two schools into a college. And at that point, the nursing program was just starting. And so we did a year-long investigation, we hired a consultant, we worked with faculty and staff, worked with accrediting bodies, and found that really there were no significant barriers to us not becoming a college. So the College of Integrated Health Sciences is actually a CEF accredited college of public health. And then nursing has its own accreditation and social welfare has its own accreditation. So last year, after the provost read our first report, she said, okay, now I would like you to work on creating this integrated college. So last year we hired a second consultant. We had 3 work groups, the vision, missions, and values work group, the college name, and organizational structure work group. And then we had a transition steering committee work group that helps Erin Bell, who is now the dean, and I actually communicate with faculty, staff, the broader university community about the work we were doing. At the end of last year, we had to submit a second report to the provost where we made all the recommendations for the college, what we thought the organizational structure should be like, what we thought the name should be, and then the vision, mission, and values. This was a year-long process that included presenting before the University Senate a couple of times, some in-person faculty, staff, and student town hall meetings and work group meetings. And then in May, when the final recommendations were made by the work group, everyone in the college voted on it. And that's how we came to the point of having the recommendations that we did. And then the provost sent a report to the president, and it was announced that this college would be created. There was a national search last year for a dean of the college. We interviewed 4 different people, came to campus. And in the end, the provost decided that the best combination for the creation of this new college would be for Erin Bell to become the dean, as someone who has 23 years of experience in the School of Public Health, and that I would become the senior vice dean and the director of the School of Social Welfare. So here's the leadership. Yes, Aaron and I coordinate our clothes in class, for now they use this picture everywhere and make fun of us. But so Aaron is the dean of the College of Integrated Health Sciences, and she's a professor in the departments of environmental health sciences and epidemiology and biostatistics. She's done extensive work in PFAS. She's worked with Hoosick Falls. She's worked with it's in the Hudson Valley. I can't think of the name of it right now, but that's where a lot of her work has been. I'm a professor and director, as you know, and the senior vice dean, and then also the director of the Center for Healthy Aging. So the mission and vision work group came together, and they had developed a mission, vision, and then goals for the college. And this is the final version of the mission, which is the College of Integrated Health Sciences advances well-being for all through interdisciplinary, practice-based education, research, scholarship, and meaningful community engagement to achieve social justice and equity locally and globally. And our vision is that we envision an equitable society in which all individuals and communities experience optimal health and well-being through social, economic, and environmental justice. And what's so great about bringing public health, social work, and nursing together is if you look at all of our accreditation standards and the missions and visions of our professions, they all include social justice, health and well-being, and environmental justice. So it's a really good, we bring really complementary visions and missions, and also work skills to the college. So the college has 3 disciplines: nursing, public health, and social work. And the nursing program is fairly new. It became as a completion program, started with Hudson Valley. Students would get their RN, and then they would come to the University at Albany to get their BSN in 4 years. In New York State, you have to have your BSN in 10 years. Then with the closure of the College of St. Rose, we took on their nursing students here, and their relationship is with St. Peter's Hospital. And so they have what's called a 1-2-1 program where students would go to St. Rose for a year, then they would go and do their nursing for a year, and then 1-2 years, and then come back. So it was a combination program. So we now have that program as well. And we just got through Cassandra Marshall, who is the director of the nursing program, just got through the University Senate, a standard 4-year BSN program. So now it's off to SUNY to do its magic. I was telling someone earlier today, we had 1,700 applications to our nursing program, and we have 30 seats for the fall. That just shows the demand for nursing, and we really are the only public option in the capital region. All the other options are private. And we're now building a relationship. Aaron and Cassandra have been working with Albany Medical Center, that we're also gonna have a nursing program with them, because of course they're very short-staffed as well. And we're gonna bring social work. They have a pretty strong social work department. Hopefully have more internships there. So we have 28 academic programs in the college. We have undergraduate degrees in nursing, public health, and social work. And we have a master's of public health and a master's of social work. And we also have a dual degree, a master's in public health and a master's in social work together. And the School of Social Welfare has 6 other dual degrees, like with criminal justice is one of them that we have. We also have a MSW-JD degree. We also have Masters of Science degrees in biomedical sciences, biostatistics, environmental health sciences, epidemiology, and a master's degree in public health nursing. We are hoping to expand some of our degree offerings as we grow, to include, well, one of my major wishes and my associate deans is to have a master's degree in psychiatric nursing, because in that program you could have social work educators and public health and nursing educators working together. We have doctoral degrees in biomedical sciences, biostatistics, environmental health, epidemiology, public health, and social welfare. And the former School of Public Health has several different graduate certificate programs. They have one in global health. They have one in maternal and child health as well. So the organizational structure, we have 4 departments. As you can see, the Department of Biomedical Sciences, Environmental Health Sciences, Epidemiology and Biostatistics, and Health Policy, Management and Behavior, which is actually the closest to social work in terms of being able to teach across disciplines. Our goal is to cross-list classes in the future and have social work students and public health students, and in some cases, nursing students sitting in the same classrooms together. There's also the nursing units. Right now, it's just a program. The goal is for it to become a department with 1,700 applicants. I don't think it'll be very long before it's a department. And the School of Social Welfare has maintained its status as a school. And so its structure within the college has stayed the same, except I, report to Aaron, and we have associate deans at the college level for research and for academic affairs. So the very interesting piece about this, it wasn't considered a barrier, but it does will change the curriculum slightly in social welfare and in nursing. The way CEF works, which is the accrediting body for public health, is if you have a college that is an accredited public health college and you have other disciplines in that college, every discipline in the college has to take a course called Introduction to Public Health, which all public health students take already. So now we're in the process of, over the next year, to meet our deadline with CEF, we are creating an Introduction to Public Health course that will be taught to nursing students, social welfare students, and public health students. And what Aaron and I, with input from faculty, decided is that if social workers and nurses have to learn about public health should have to learn about social work and nursing. So we're going to have modules that will be included in the public health course. In social welfare, it's highly likely that this will be an asynchronous course that students will take by the time they graduate. And it'll be 0 credits, so we don't have to go back to the state and change our curriculum totally. So public health accreditation, we all fall under that because the college is accredited. In social welfare, we have a bachelor's of science on the undergraduate level and a master's of social work. These are fully accredited by the Council on Social Work Education. And we go up for our reaffirmation, that's what they call it, reaccreditation. In 2000, we were supposed to go up this year, but we delayed it because of the creation of the new college. And then the nursing programs are seeking accreditation from CCNE. They actually had their site visit in February and it went very well. They already have received comments from the accrediting site visitors and they're making those changes. So they're well on their way to being accredited. But what's really interesting about the college, and it was the only school of public health, but now it's the only college in the nation that has a partnership with the Department of Health, the New York State Department of Health, with a memorandum of understanding. So we have faculty members who are employees of the Wadsworth Center and the Department of Health, and they have interns, they mentor doctoral students, master's degree students, and they work in the Wadsworth lab. And then we have, so some of those faculty who are employees of DOH teach too for us, but they're not state employed tenure track faculty. So in public health, they have both kinds of faculty. And now the MOU is being updated to include social welfare and to also include nursing, so that the Department of Health is very excited to be having the possibility of having MSW students and nursing students that can also be at the Department of Health. So our people, so right now, we have 1,012 current students. We are the largest college. The only one bigger than us is the College of Arts and Sciences right now. We have 197 expert faculty. That includes our DOH faculty. And we have 11,946 alumni worldwide. Some examples of some of the work that we do, and we have the Center for Global Health. Last week, they had a wonderful dinner for international students on the East Campus. So this proactively engages with a wide range of partners around the world and works in close collaboration with faculty and partner organizations in the Capital Region. There's a refugee community in the West Hill, and the Global Center is very actively involved in that. This past weekend, they had a community cleanup day and lunch there. This, as you can imagine, since COVID, it's been harder to organize trips and study abroad, especially for graduate programs. We also have several in the School of Social Welfare, and the International Office has been still very actively engaged with undergraduate study abroad programs, but they have not brought back the graduate ones. And now with the current things that are going on nationally, it's you know, as you saw in the news last week, we had 4 international students and graduates who visas were terminated. So it'll be interesting to see. We are absolutely committed to our international students, however. We also have the Maternal and Child Health Program, which was founded in 2015. They just celebrated their 10th anniversary last month, and we had a great celebration at the East Campus. So students can actually get a certificate as part of their master's degree, get a certificate in maternal and child health, provides a wide range of academic and professional development opportunities. And even before we were a college, there were students in the School of Social Welfare who got the maternal and child health program certificate. We're watching very closely what's going on at CDC and NIH, and because maternal and child health programs are on the chopping block. What's really great is the college is made up of all professional disciplines. So each of these disciplines requires hands-on experiential experience as part for course credit. So in the MSW program, students do 900 clinical hours across 2 years. So they do 450 hours 1 year and 450 hours in a different agency the next year. In public health, they do 720 internship hours, and then nursing students do 480 clinical hours. The accreditation standards for CEF are going to now require that undergraduate students also have hands-on experiential learning. Social work already does, they have an internship, but we're gonna be using the Community and Public Service Program, which serves undergraduate students across campus and like lots of different organizations. Sherry Stevens runs that program. So undergraduate students in public health will utilize that. We're in the midst of figuring that out. We have lots of hands-on learning. These are just a sample of some of our placement sites. In the School of Social Welfare alone, we work with more than 400 organizations each year placing students. So I'm going to stop here to see if you have any questions about the college.
This is a nursing question. I see Erin periodically because the math department has a colloquia just down the hall
Yes.
from her office. And where do you, the two of you want to see the nursing enrollment land? It's teeny right now, but you haven't moved either.
Right, and we don't really have a lot of faculty
That's
either, right? We have, I think, one clinical faculty. I know that the provost is hoping that the program will, grow. So I don't know, she hasn't said a top number, but I could see us, educating 200, 300 nurses a year. It's gonna depend on how many. It always depends, just like with social work. It depends on how many placement sites you have, because they do have to do this clinical rotation.
The comparison, math department has got their topological data analysis program is booming. It started with 23 years ago. It's got 400.
Yeah.
And the dean would take it to 8 if we could get enough faculty. And
That really-
that's good. And that was what Aaron said.
Yes.
Same thing, you guys.
And in nursing, I don't know how many of you know this, but I would say for about 10 years, there has been really a shortage of PhD trained nurses to fill some positions that are available across the nation. Because you have clinical nursing faculty and then the more of the research-based faculty. So that has been an issue too. Like, you can't admit students if you don't have qualified faculty to teach them. Yeah, Nancy.
Will still be offering a certificate in emergency preparedness.
I believe so. I don't think that's gonna change, but that's a relationship with CEHC, right? The college, yeah. There's been no talk of that going away. I would like, I would actually like social work to be more involved in that, because I think social workers should be prepared to help in emergencies. There's a role for them to play as well, especially when you talk about aging in place and emergency preparedness. Other questions about the college?
Would you consider retirees for positions in the nursing program? Not as students, but as faculty, but someone that has her nursing degree at a very high level and was a dean at Excelsior.
Oh, yeah, I'm sure that
Okay.
just because you're retired from one place doesn't mean you can't work at another, yeah. Yeah.
There may be folks out there, and on this one, good friend of my daughter's, and I'll let Devin know. Her daughter also swam for not starfish, starfishing. So anyway.
Great, and we sometimes, so next year, our school will be having a visiting assistant professor line, and so it's really a lot of people who are retired or who live in the area, don't want to move somewhere else, but would like to teach and work with students. That's also a really good line, or instructor lines too. I know that the university is looking at instructor lines more and lecturers. Right.
But good person, I know her very well, and so I'll toss that out.
But faculty, back to what you were saying, we since I have been when I was the acting dean, then I was the interim dean, and now in this position, there have been, 7 retirements. 4 this year, 3 retirements this year, and a person who is leaving. And they're not replacing lines as fast as people are retiring.
And even if they did, and I've seen this in math, and I know you guys are thinking about it, you can't produce a new faculty member quickly.
No,
It's-
you can't.
There's no short path to that. So forget about local issues, just look everywhere. You
Yes,
still can't get them.
right. You can't. Any other thoughts? So we're really excited. The one thing I didn't tell you is, a former School of Public Health is going to be moving to the main campus on June 2nd, into the former Earth Science Mathematics Building, which is now called Pine Bush. So the first phase of renovations in that building will be done. And so they'll be moving in, and then 2 Junes from now, this School of Social Welfare will also move into that building. So that will all be in the same space. I'm really excited about it. I know some faculty would like to stay in the downtown campus, but I just think being co-located is going to present amazing opportunities. I don't know why that river makes it so hard for people to go from the East Campus to downtown or uptown, but it does. And so I think that would be great. It's also, there's lots of, as you know, lots of energy on the uptown campus with, students, and there's actually food. Our cafeterias don't even open on the downtown campus anymore. So I think there are lots of opportunities there.
One other thing is Wadsworth, that project got stalled for like 3 years. They were fighting over principal things.
Yes,
And now they're into problem solving. It's an active work site. So that's moving.
right. And they'll be right there,
Right there.
which will be very exciting. Any other thoughts about the college? Okay, so the other thing that Carol and many of you in this room asked me to talk about was the Center for Healthy Aging, which I am the inaugural director of that. I have spent my entire career working with older adults, doing research with older adults, developing interventions to support older adults and their caregivers. And I actually, my training in that role started here. The School of Social Welfare had a very robust gerontology research arm when I was a doctoral student many years ago. So how did the Center for Healthy Aging come into being? Provost Kim and Cash Kesavatis, when they first took on their roles, they identified a couple of areas where they would like to grow research. Provost Kim came to us from the University of Maine, where when she was the vice president for research there, she developed a healthy aging initiative there. And so that was something she wanted to work on here. And Cash wanted to work on AI. That was the AI initiative and the Global Center for AI and Mental Health. So it was a 2-year process. We started with 2 internal conferences. We started with a work group. We got faculty together who were doing work in aging or interested in doing work in aging. And we had an internal conference and we brought people together and they did lightning talks and talked about their work. And then we kept meeting. And then in the spring, we had an external conference where we invited people to come from the outside. So we had Trish D'Ambrosio, who is the director for the Reframing Aging Center at the Gerontological Society. She came in and talked about ageism. And then people gave we had Greg Olson from the New York State Department of Health. We had some national people who were doing some basic science research comment and talk about their work. At the end of 2 years, we had developed a working group and also developed an external advisory committee of 16 people, national experts, state level experts, and local experts. So over this time period, we worked on a vision and a mission for the Center for Healthy Aging. It's situated in the Institute for Social and Health Equity, which is the director is Paul Morgan. The Institute for Social and Health Equity has 3 centers in it. The Center for Healthy Aging, the Center for the Elimination of Minority Health Disparities, and then the Center for Social and Demographic Analysis. So establishing this center represents the next step in the institutionalization of university-wide and interdisciplinary work. The vision that the provost and the vice president for research and economic development have is that you should centralize research and have people working across disciplines on research and educating students. Everything right now at NIH and a lot of other federal funding agencies is up in the air, but previous to this administration, there was a very heavy focus on interdisciplinary research, that the kinds of social problems that we are dealing with cannot be solved by one discipline, that you have to have many, many people at the table. So the vision and mission of the center is to improve all aspects of aging, to prevent age-related diseases, and to decrease the economic burden of age-related pathological and social disorders. New York State has the second largest aging population, and we're growing, second only to California. And so this is it's really important that we help people stay healthy as they age, and that we have good prevention. And so it is a major issue for our state. So the mission of our center is to serve as a hub for cutting edge research, training, and comprehensive programs that promote healthy aging and prevent age-related diseases. And you can do this by bringing together research community partners who actually know what are the community's needs. Every community has different issues, right? One community may have high levels of cardiovascular disease, and another community, it may be diabetes. So tailoring the needs to the community. Another really important piece in this is workforce development. As people age, they often need support. It can be little support, like they need help with grocery shopping, or they need someone to mow their lawn, or they may need to have someone in their house 24 hours a day because their loved ones live far away and they cannot be independent. So we have to develop a workforce, and there, as we know, is a shortage in the workforce for CNAs, homemakers, nurses, physicians are really hard to find, primary care physicians right now. There aren't enough nursing home beds, and there's been a lot of bad press around nursing homes since the COVID epidemic. So we really do need to develop a workforce. So the center has 4 pillars. There's research and innovation. So looking at things like cell senescence, there is actually a group of faculty researchers being led by Andre Melendez, who are putting together an NIH grant that they hope to submit in June around cell senescence. Also looking at engineering school and with ETech, assistive devices and virtual reality. We have a $1 million, well, the college does $1 million grant, and to develop a simulation lab where you can have nursing students and public health students and social work students using virtual reality. Also, universal design, heavy emphasis on the social determinants of health. We know that the social determinants of health have a significant influence on how we age in every country. Also, emergency preparedness, climate change and aging, and also accessible housing, which is a big issue right now. Then we also have education and training. So we've talked about developing workforce pipelines so that we have people who are exposed to gerontology and the specialty early on. So thinking about how do we get undergraduate students interested in working with older adults? Do we develop a micro-credential? Do we develop a certificate program? Because many times, even though many, for example, social workers end up in the field of aging, a lot of them do. But when they come to school, they say, I want to work with children, or I want to work with families. But in the end, they end up working with older adults, and they don't necessarily have the expertise at the beginning to do that. And also, you know, the micro-credentialing, we're thinking about a certificate in aging. We already do have a program in geriatric social work. We have the Internships in Aging project, which trains second-year MSW students to work with older adults. They actually do internships in 2 different agencies. They have specialized training every month. It was originally funded by the John A. Hartford Foundation, and this year it's celebrating its 25th anniversary. We're hoping to expand that to include public health students so that they can also have these specialized internships in gerontology. Also, which the vice president is certainly looking at, community and industry partnerships. How can we partner with federal government, state and local governments to provide supports for older adults, and then translating things into practice? So implementation science, the college in public health, they just actually hired a new faculty member whose specialty is in implementation science. We also need policy management and technology. sandbox? How do we influence policy? How do we understand policy? Looks like there are going to be huge changes coming over the next couple of years in terms of Medicare and Medicaid.
Have you thought about on the bottom to community and industry partners and translation practice? I work and volunteer at a place that gets hundreds of people over the age of 50.
Wow, yep,
It's called Y. And you've got this community of YMCA's in this area
yes,
that open at 5:30 in the morning. They don't close till about 9 o'clock at night, and they provide services mainly around exercise, but they also teach yoga. I just got done with a 7-week swimming course that I teach along with some of my colleagues, 2 of whom were here as professionals. And that to me is a sort of a playground for research.
oh yeah, I would agree.
Because you've got everything at the formal level that my healthcare provider will pay for my Y membership,
Yep.
which you get, I think CDPHP does that. To the informal, which is, hey, tomatoes are coming into bloom. Anybody want some? People bring bags in,
Right.
things like that. So you've got that all going on all day, every day. They don't close very often, but that's sort of rife for research. And you don't have a lot of retired lifeguards there. But we do have lifeguards in my age bracket. So, you know, there's a way to approach people in that age bracket. You know, they like the younger kids that are doing this and that, but I'm a practitioner being an aging adult.
Right.
How do you get your researchers to get into that culture? Because it is a culture, subculture.
Right, I mean, the relationship development takes a while, right?
Yeah.
So it's finding, most of my work has been done in community agencies that I've had long-standing relationships with, and it's finding either a doctoral student or a new faculty member or someone who really is interested in working with older adults in the Oregon, and the Y is definitely a
Yeah,
terrific
I mean,
place to do that.
Hundreds. And it runs from 3 or 4 types of yoga to pickleball, to training for triathlon, if you want to do that, and many other things that folks can do. Sign up for, try it. If they don't like it, they can drop it and try something else. But it's, to me, that's sort of the kind of a community group that already exists.
Yep. You don't have to reinvent them. When so the New York State, the Arthritis Foundation,
Yes.
it used to have 5 chapters in New York State. Now it has 4. And when I was starting out my career, I did research with them, and it was on their exercise programs.
Yep.
So they had Tai Chi, they had swimming, aquatics, different programs, and a lot of the programs were offered at like the Y.
Yeah.
And so we had people we were evaluating these programs with money from New York State, and so we would get thousands of people to fill out the pre and post surveys in these community agencies.
Yeah, to me, this is, and you've also got the Shikati Center in
Mm-hmm.
college. There's all these groups that are out there. And you can take your pick. Okay,
Yep.
if you got somebody interested in that, who really wants to learn, do some research, and start their career sort of moving in that direction, there's ways out there.
Yes, there definitely are. Any other thoughts right now? So there really are 2 thrusts to the center. We said, okay, if we're gonna have a center for healthy aging, we can't do everything all at once, right? There's only so many people, so much money. So we decided there would be 2 areas, because it's where the faculty interest was as well right now, and the community, our advisory board. So the first area is biological innovations in aging science. And so we're starting with senescence because there is really a cluster of faculty who are interested in that right now, and they're working on a grant. Another area that bubbled up that hasn't been really moving forward yet is oral hygiene in older adults and saliva testing. But that hasn't moved forward so much. The other is really cutting edge research, new training and program innovations in social and behavioral sciences. So here we do want to focus on more curriculum development for undergraduates and graduate students to train them to work with other older adults and how to understand aging better, and to build a career pipeline for health and social service careers in aging. And we're thinking of social work, psychology, public health, human development. These are all programs we already have here, and mental health counseling. So what do we expect that the impact and the benefits will be? So in the biological innovations thrust area, we'll train the next generation of scientists and engineers in state-of-the-art tools, systems, and technologies for aging research with a focus on pharmacology, nutrition, social interventions that promote longevity. As I read this, and when we talked about these impacts and what is right now happening, I think there are a lot of things that are not going to be funded that would have been funded previously. And so I think one of the major, not struggles, but one of the things we're going to have to be very creative about, not just in the Center for Healthy Aging, but in all of our centers on the university campus, is how are we going to fund our research? The Administration on Community Living, which, is big federal agency that focuses on older adults and also people with disabilities, is being dismantled. It's not going to exist. And the pieces of it are going to be put in other agencies at the federal level. So I think we have to be concerned about that. It's the same is true with CDC. They're really dismantling it. A lot of research, they're not going to fund it anymore. So in the second thrust area, social and behavioral interventions in aging, this one is focusing on evidence-based interventions and evaluating the workforce. And this includes things like caregiving, substance use, social isolation, elder abuse, healthy longevity, definitely emergency preparedness is included in here as well. We also have you talked about the why. Collaboration is critical for success, right? So we have several collaborators, like the grant makers in aging, the federal government, state and local government. We have several people who are involved with the Center for Healthy Aging who are on the committees for a master plan for aging, which supposedly the final copy is going to be coming out soon. Also, the American Society on Aging. So we have a lot of different partners. And then we also have the people on our community advisory board sit on some of our parts of some of these agencies. So where are we now? So we've created this, and now we have a core group that is meeting. And for our first activity, other than the grant that's being worked on right now, is we are developing an Aging Well speaker series for next year. Every other month, we will have a local or nationally known speaker come and talk on some aspect of aging. We have someone coming to talk about palliative care app that he's developing for Trinity Healthcare. We have a local Dina Refke. I don't know if any of you know her. She's the director of the Center for Women in Civil Society, Women in Government and Civil Society. She's doing a very interesting ageism project with the Albany County Department of Aging, that they're funding it. And so she's going to come and present on her work as well. We have one more slot to fill, and then we're hoping to start to advertise it at the beginning of the summer. And we are also developing a website. Those are the two major things that we've started working on right now. Do you have any ideas or questions or thoughts? Yes, Nancy.
One of the things about aging that I find very interesting is it's something that I think we all look forward to experiencing. But when we get there, wherever it is, I've heard plus 50, I've heard plus 60, I've heard plus 75, we become subjects. And my concern is that in this initiative, one of the things that we are not looking at is what happens when we're done aging. I think that's very, very important. Secondly, as a professional ager, I am now 78 years old. I would prefer not to be looked at as a study subject, but as capable of being actively involved in either performing support to my peers. I don't mind being subject, but I think it's a unique aspect of social welfare where we are all looking at them when they are in fact us tomorrow. I'm very
Right.
concerned about.
Right, and I share that concern too, and I think ageism is a huge issue in our society, and even in conversations when we're developing the Center for Healthy Aging, you know, I would have to, several of us would have to remind our peers that focusing on aging is not just focusing on pathology and that people are going to get old and sick. No, many people live well into their 90s, being very active, productive members of society, and that we can't just focus on the pathology piece of aging. We have to make sure we're using the right words when we're talking about older adults, which is where the whole Reframing Aging initiative at the Gerontological Society is as well.
I had a question about local government. You mentioned people need to help to get their groceries or, shovel snow. Albany and other communities are like this, have a rule about your walk has to be shoveled within
Right.
24 hours.
Or you'll get fined. Huh?
Right.
Yeah.
Now, the person's 80 years old, you could think that person's probably been a taxpayer for many decades. Don't you think we could have as part of our gift back to the community, if neighbors don't shovel, let someone else shovel.
Right.
And I've shoveled people out for decades and decades, just because I feel I want to do it, but the city ought to have the same attitude. I don't want to.
Oh, I agree. Right. I mean, that's just one example of an age unfriendly policy, right? You have people who want to be able to stay in their homes. They've lived there, like my grandmother lived in her house for over 70 years, but it became increasingly more difficult as she got older to shovel, to mow the lawn, to do these things. But people are better off if they stay home in most situations. And but we don't have policies in place that really help that. We say we do, but we don't. For example, there are very few communities that have pay for homemaker services. Schenectady County, we use their own money to do that. And my mother needed a homemaker for a while, but not every county in New York State even has that. And now it looks like some of that funding is going to go away.
Do you have any questions for me? Thank you very
Sure.
much for coming.
Thanks.
Well, I hope we got that. So
I hope you do.
you can just pull that right out. Yep, should be fine. Thank you so much. That was
Sure.
great. It's nice that you go this way. Don't trip.
No, we don't want anyone
We should
to.
avoid the trip. Yes.
Oh, yeah. Don't say anything.